Hey everybody, how you doing? All right, so we're gonna go live today. I'm answering questions, and let's see, are we on? Um, all right, waiting. Okay. All right, so we're going live today. I'm answering some questions. I had a lot of feedback, so thank you. Everybody knows tomorrow I'm having my surgery. This will be my second surgery to remove the cancer on my kidneys. Just to give you a quick little rundown. So they found cancer on both my kidneys, on the right and left. On the left, it was bigger. The tumor was bigger, so they went for that one first. And then on the right side was smaller, so that's the one they're going to do tomorrow. All right. So I have questions from lots of people ask me different questions. So we'll start off with the first one is, how long is the recovery process? So that all depends on the kind of surgery I have. So I'm told as of right now I'm gonna have a orthoscopic, but I've been told that the last two surgeries that they're going to go orthoscopic, and they always change it right before. So if they do it orthoscopic, the recovery time will be quicker, but I have a big feeling that it's not going to be orthoscopic, and then they're gonna probably open me up like they did with the last one. But so it'll take a little longer, and if it's orthoscopic, I should only be in the hospital about a day, two at the most, I think. And if it's if they do have to open me up, I would be in the hospital for, I think, three days to about 5 a week at the max, as long as, depending on how everything goes. All right, so that all depends on the process. One other thing I want to bring up in that sense, whenever you're having surgery for pretty much anything, you have to be ready for things to change. That's something I've dealt with many times. Like, I've been in the pre-op and my surgery got pushed back, and then they had to do it another day. There's always other things happening. You never know. A lot of times things go as planned, but you have to be ready for changes in your surgery. And that's just kind of a normal thing, at least that I've dealt with all the times I've had surgery. All right, let's see. If anybody's on, let me know you're on. Leave a comment, and leave a like. And if you have any questions during it, please write them down, and I'll get to them also. All right. So next question is, how will you know if the surgery is successful? So I will speak on the last surgery I had, and that was for the left kidney. And after, the surgeon told me that they found the tumor was encapsulated. So here's my kidney, and then the tumor was connected. And at first, from the CT scan and stuff, they thought they were going to have to take out a larger piece of my kidney. But luckily, they only had to take out a small piece of my kidney, and then the tumor that was connected, and it was encapsulated. So that means it was all in one little area, and they removed it easily. So hopefully everything goes the same way tomorrow, and to me that's successful. And then I'm assuming in a few weeks later they'll do another CT scan, another scan, to make sure that everything is gone and everything's fine. But that's just my estimate. I'm not 100%. But I believe that's the process. So this is another question for a friend of mine that's going to have surgery next month. Very similar. she asked me, can we bring stuff to the hospital? You really don't want to bring too many things, especially right now with COVID, and you're only going to be in the hospital a couple of days at the most. You know, they're really trying to get people in and out. They don't want you in the hospital for a long stay because of COVID and everything that's going on, and they really don't keep you in the hospital longer than you need to be. What should you bring? I'll just let you know what I bring. Last time I brought my iPhone charger, and I brought Q-tips. I have a little, I want my ears to be clean always, so I brought Q-tips. I didn't even use them. They had stuff at the hospital, but I just come prepared in that sense. Everything else they give you, like, you know, my friend was asking me, should I bring, you know, toothpaste? Should I bring this? Should I bring that? They're gonna supply you with everything you need. The hospital. But that's basically all I need to bring. I brought a change of clothes for when I do leave the hospital, and that's it. You know, so a change of clothes. I brought my iPhone and my phone charger, and Q-tips. You know, but everybody's different. Whatever, you know. But mostly everything you need, the hospital will provide. Okay, let's see. This is another thing my friend has been thinking about a lot, was how many people are in the operating room. It's not something I can't say 100% how many people are in the operating room, but there's a good amount of people, and it all depends on what kind of surgery you're having. You know, so you know, I've had a heart transplant and I've had other, you know, major surgeries. So this one's not, I mean, it's a big surgery, but it's not like the other ones. So there will be less people, but usually there's the main surgeon, probably one, you know, sometimes there's another one. And you got the nurses that are working with them, the OR nurses, and you have the anesthesiologist. So there's a good amount of people in there, and they're all, like, the one thing I was telling my friend, you got to remember, everybody that is there to help you and to make sure everything goes properly. So don't get too hung up on little details that aren't really that important. Like, of course you want to know, and they're always, all these questions are to make you be comfortable and you know, but you don't, some of these things are not ever really going to matter too much when it really comes down to it. All right. So here's a more complicated question. So how do I feel going through the process, you know, with the hospitals and the doctor's visits and the whole process of everything? You know, from my first surgery to now. So for me, it's never really bothered me too much. You know, when I was younger, I was in the hospital for 7 months, and it became a for me, it became a place of comfort. I know most people hate the whole process. They hate the smell of the hospital. They do not like they don't like most of it. You know, there's a lot to it. You know, like, you got to get a lot of IVs. You got to get blood tests every day. You know, when I was younger, my routine every morning was blood test, like at 5 a.m, an X-ray within that next hour. And that was just like the early morning stuff, and then you get your vitals done all the time, and then depending on what else they're doing. But all that stuff, to me, I would just, a lot of times sleep through. It doesn't really bother me. I know everybody's different, and there's a big difference. When I was younger, everything happened. It was a long period, but it happened fast, in the sense of I ended up having an LVAD. An LVAD is a left ventricular assist device, and it's actually right here. Donald Duck. So this is my LVAD, and this thing was implanted in me in my side, like right down here. And this is one of the first models, if not, like, I think it's like the second model. It's called the HeartMate 1, and it's a titanium device that they implanted in my side. It was down here, and up here it would connect to the heart, and then right here there was a connection that will go out to this big device. It was like an old VCR, like that was on a roller, and this thing. I think when they told me I was probably gonna get it, it was fairly quick. I was so sick that they're like, we're probably gonna give you this LVAD. I was the first person at Children's Hospital, LA, to have it done, to have one of these put in me. At the time, I was the youngest person in the world to have this LVAD done, and I had it for about 3 months, and this is what it looks like. There's like, it's so the blood doesn't clot, and over here it would be a balloon pump, and this whole thing pumped for my heart. Unfortunately, it malfunctioned. So one day I was I wasn't feeling good, and here, put this down. One day I wasn't feeling good, and what happened was, so these were these tubes that connect to the heart. It kind of, the suture or something disconnected, and I started internally bleeding. It took them a while, I don't know how long, but eventually I just started bloating because I was filling up with blood, and they had to race me up to the surgery. So when these things happen for me, like when I was younger, everything was fast. Everything was, there's no time to really process it and get ready for what's happening. And then that happened, and then it happened again within like 2 weeks. It internally bled again, and so that would have been my third open heart surgery. And then I think like 3-4 weeks later, I got my transplant, and that's when they removed it. So that compared to now, like I had another heart surgery, a valve replacement, done 5 years ago, and they told me about a few months before that I was gonna have to have this valve replacement, and that's very different than everything happening immediately, like racing up to the OR and stuff, and you have to process it, you have to get ready for it. Like tomorrow, I've known I was gonna have 2 surgeries for months now. I had one in April, and now I'm having the next one tomorrow. And again, things may change. Something might happen where I get bumped off of the OR. With my last surgery, with 2 surgeries ago with the open heart, I went in, and there was an emergency case, and we're waiting there. The surgeon came in and was like, we all need to help out with this surgery, and do you want to wait, or do you want to reschedule it for later in the week? And at the time I was like, I'll just wait, let's just get this over with. And then the surgeon was like, we should probably wait, we'll have you, because that was a Monday, we'll have you do it on Friday, and we'll be, you'll be the first surgery, we'll be nice and rested, and we'll be ready to go in. And I trust my doctors, I trust the team, and that's what we did, and everything worked out the way it should. So I really trust the process. It's different because there's so much more time to think about things, but I really don't let it bother me. And like, don't get me wrong. Last night, I stayed up late. I was thinking about things, but it doesn't really. I don't really stress out too much. Tomorrow or tonight, I probably won't sleep too well, but I might. I don't know. Yeah, so it's different. It all depends on how everything happens. So I know other people could relate if you have to have a surgery planned out, and then when you have to have a surgery immediately, it's a very different, just very different on how that goes. All right, let's see. This is a question from my sister. So she asked me, like, how do I stay so calm? I don't really know. My sister is very opposite than me. She gets scared going to the dentist, and she's like I just saw her. I took her some food, and she was asking how. And we've talked about this, before. Like, how do I stay so calm during this? And I don't really know exactly how and why. I just do. I don't let things bother me. I really, I let don't get me wrong, things bother me, and I let weird little things irritate me. But stuff like this, I'm very confident in my doctors. I'm very confident very confident with God that things are going to work out, and that's how I feel. But it's not always easy. Like, it's not easy. It's just the way it is. Let's see. Let's see. That one. So here's another one that's pretty good. What are my fears and what scares me? So I let a lot of stuff go a long time ago when it comes to my health. I lived so long, and since my transplant, and I never thought I was gonna live long. I'm at that point right now where, honestly, if things go bad and I pass away, I'm totally fine with that. I'm not. I've lived a great life. Of course there are things I still want to accomplish, but I honestly, I should have died 24 years ago, and I'm still here. But don't get me wrong, I feel I'm gonna survive everything. I feel confident that, with my doctors, the Lord, and myself, we're all strong enough to handle this. But I'm okay with whatever the outcome is. I'm okay with not being here, if that's what happens. And I just kind of left it up to the Lord a long time ago. And don't get me wrong, like I'll be more scared if I go on a roller coaster than I do going to surgery. Which is, I don't know, weird. I don't even really get it. And let's see, what scares me? I don't know. I just, I hope I lived a good life. I hope whoever my donor was, which I don't know, they would, be proud of the person I became. And I know I made a lot of mistakes, but I think I'm a real good person, and I'm just okay with whatever happens. Let's see. So here's another one I never thought about, but this was just asked to me recently. What goes through my head before I go under? So I could speak on, very clearly with my last surgery. I was being wheeled in to the OR operating room, and I looked to my left, or my right. I looked to my right because I was being wheeled in this way, and there was just like all these surgical equipments right there, and I was like, oh shit, don't focus on it. because I know that all these instruments are what's going to be used to open me up and to go in my body. And then I was basically like, dude, just put me under. I put me under already, and I've been under a lot, so it doesn't really scare me. And, just let's go already. Go do what you guys got to do. But it's always different. I say a prayer. I do say a prayer to myself. I think about my family. I think about whoever's in my life that I care about, and mostly my mom has been my biggest support system. My sister, so, and of course my family and my friends. You have to go through. So here's another thing. The things it's a weird kind of question. What are the things I go through, with the healing process? So there's a lot of little things that you won't think about, but you remember when you have surgery. So like after my surgery, sneezing within that first week of your surgery sucks. It's a weird thing when you have to sneeze, after after the surgery, because you got to remember they're opening up, like for this last surgery they opened up my stomach, and when you sneeze you kind of like you contract and it just hurts. So I don't know how everybody sneezes a little different, but I have like big sneezes, and then like I'm just like I'll hold a pillow if I could get to one in time, and I'll sneeze. But like that's just something that's it's a weird little thing that you you kind of only know when you're dealing with it. Let's see. And there's just a lot of little things. Like after surgery, I really don't try to eat a lot because I'm really not trying to use the restroom too much. And and then it's sleep. So this is one. So with this last surgery, they went down my stomach from like here to here, and then the one before that they went here to here. It was a heart surgery. So you have to. It's a very different healing process, and for me, I don't want to lay down after a couple days. Like it's different when you're in the hospital because you're on a lot of drugs and the beds go up and down. But when you're like home and your bed's flat, you're not trying to, when you have to pick yourself up and there's no like rail or something, it just sucks. I sleep on my couch and I just sit up, for the next week, give or take. And it all depends on the surgery, so if they actually cut you open, it's going to be hard. It's a longer healing process. If they're doing orthoscopic, it's not as bad, but so then that's always something that's different depending on what kind of surgery it is. Yeah. Let's see. Let's see. So I think we got to it before, but I don't. Yeah, can anyone come to the hospital with you? So actually, right before this, I got a call from the hospital liaison, and they were telling me actually something different than I heard yesterday. So, again, you always have to be ready for a change. And hold on, my thing messed up. Here we go. So you always have to be ready for changes. I was talking to my friend last night who was going to have surgery next month, and she was, just asking a lot of questions. And you got to remember, every hospital is different. So right now with COVID, with my last surgery, nobody could go with me. I had to walk in by myself, and I had to walk out by myself. it wasn't as bad as it sounds, at least for me. I don't know how everybody else will take it, but for me, it wasn't really that bad. Everything happened fast, and like with the phones nowadays, you could FaceTime people, and you don't feel alone. And I've been used to being at the hospitals by myself for a long time, so it's not that bad. Again, for me, everybody else is different. So right now, the hospital liaison for USC texted me or called me, and then she said, "You have one designated visitor." And when I go into the hospital, so yesterday I was told that, will be my designated visitor will be my mom. She could go to the pre-op with me, but now they're saying no, she can't go to the pre-op with me. So she could wait in the lobby, but there's no point in waiting in the lobby, in my opinion. She should just go home, be with my family. And I mean, because not like once I go in, I'm going to go into the pre-op and I'm going to be by myself, I'm going to be by myself, So yesterday I was told that she'll be able to go to pre-op with me, and then when I get wheeled into the OR, she'll have to leave and come back later. And now they told me that no, you won't be able to do that. She could just wait in the lobby and they'll communicate with her that way. And basically last time she just waited at home and they were calling and giving updates. So I can have visitors. So people who are waiting at who are in the hospital overnight can have visitors from like 2 to 6, and you could stay for 2 hours. So that's a plus, I guess, at this time. But for me, that's great. I'm okay with that. But again, everything, it's changed. I haven't even told my mom yet because they just was told within like the last hour. Okay, so you got to be ready for things to change. Everything doesn't happen exactly like they plan it, and especially right now with COVID and things that are going on, everything's up to change. Okay, so one of the things that I like doing before I go, for surgeries and stuff is I usually go out with my my friends and certain family members, or we meet up with my family, and just I feel confident everything's gonna go well. I feel confident. I feel really positive about everything, but I still want to have those, for me, and being sick the way I was, memories are something that I cherish, and I try to always make some good memories. Like last year, it was my 23rd anniversary to my transplant, and we had a big party. I threw an anniversary party. Tons of family and friends came, people I haven't seen in a long time, and it was just a great experience. Usually before a surgery, like before I had my my last heart surgery, the Saturday before, me and a bunch of friends, we went out. We all went to some bar. We hung out, and then we ended up going back to my friend's house. We stayed all night. I ended up taking one of my friends home at like 6 a.m. It was drama, but whatever. Things happen, and it was a good time. And then the next day, I had an event with my family, and then I had I was in a real estate investing club, and we had this personal event. Wasn't mine. It just happened to be on that day, which was cool. So I always try to do things like that. It's something I like doing. We can't do this right now because of COVID. But those are something that really helped me. And I think that probably has to do with when I was younger, I was in the hospital for 7 months, and just not being able to leave the hospital. I like being able to celebrate and do certain things a lot more now. All right. That. So this was a question I was asked, and it was like communicating with people who are going through something like this. And I know a lot of people don't know what to say. They don't know. They don't want to. They don't want to feel uncomfortable, and they don't want to say the wrong thing. So a lot of times they don't say anything. And I again, it goes back to everything I've been through. You know, I have no problem calling anybody. I have no problem reaching out. I know for the fact, like, I like calling people. I don't like texting if I can help it. And most of the time, people don't even answer the phone. But you could leave a message and say, "Hey, I was just thinking about you." Like, since I've been sharing my experiences since my last surgery, I found out a few of my friends have cancer and are going through some process, going through their process with it. And I think it's good. Like, you don't want to. It all depends on how close we are, and like, one of my friends, we hung out a lot more years ago, and then we got older. Families happen and everything, and we just don't talk as much. But that's a good thing about social media, and dropping a text message every now and then, and giving a call, I think, is important. And I think it's just about getting over that fear and just putting it out there. Just letting somebody know that you're thinking of them. And sometimes just saying, like, are you available to talk? Or, like, you could send a text, be like, are you available to talk? Or reach out when you get a chance. And I know other people, like, at times I don't want to reach out to people because I don't want to make it all about me. Like, I'm not calling somebody to talk about my cancer. I'm calling somebody just to bullshit with somebody and to talk about anything else but my cancer. But I'm not worried about talking about my talking about cancer. I know other everybody's different. So I don't know, like, hopefully that makes a little bit of sense. Just I could share a story when I was little. Within the first couple weeks of finding out that I needed a transplant, because I started at Glendale, Venice, then I got transferred to Children's Hospital, LA, and within, I think, the first 2 weeks, this girl that I went to junior high with, she came and visited me, and it was a girl that I never really talked to. She was somebody who was newer to the junior high that I went to, and she came and visited me. And I was very surprised because, we were never, like, really good friends or anything. But it was a small school. I went to a small private school in Eagle Rock called St. Dominic's. And, when she came and visited me, we were talking, and she was telling me how within that, I think the year before or 2 years before, because she came from another private school, somebody that she went to school with, or I think that was a really good friend of hers, passed away, and she never went to visit. So she didn't want to let that same thing happen with me. And I was like, oh shit, like, I don't want to hear that right now, But but I understood what she was saying, and I appreciate that she was able to come visit me, and I really appreciate that she was just being honest about it. She came to visit me more than some people that I really thought would come visit me. And little things like that, it's sometimes you got to get out of your comfort zone, and if you feel strongly about something, don't second guess it too much. If you really feel like you're wondering how somebody's doing, reach out, and just do whatever you feels right. But I think the worst is when you want to do something and you don't, and then you regret it later. And that's, I think, in general with everything in life. Don't put off things. That's something I'm learning. I keep learning with all these life death experiences that I keep having. You know, I'm pushing more. I'm pushing myself more and more to share what I'm going through. I'm pushing myself more and more to really push forward with my business, and I'm not always doing as much as I think I should, but it's something that I know I'm going to regret if I don't do it. You know, so, and I don't want to have those feelings. All right. So here's something. All right, so I only have a couple more. Oh, hold on. Okay. Is anybody online? Let's see. I think there's 3 people on. Thank you for being on. Please leave a comment if you're online. Just say hi or something so I know. Okay. So I don't really look at this surgery as that sensitive and that life-threatening. I understand it is, but I've had way, like, this LVAD was a motherfucker, and then with everything that went along with it, you know, the heart transplant, the valve replacement, you know, I've had other smaller surgeries that I wasn't too worried about, and I've had tons, like 100 biopsies throughout my life. So, you know, I'll go back to the transplant because I know a lot of people follow me that with the transplant stuff, especially back in the day, 24 years ago, when you had a transplant, there was certain medications that they'll give you. This medication called cyclosporin. They give you prednisone. I'm still on prednisone. I've been on prednisone 24 years. And anybody who's taken prednisone understands it's a hard drug. It gives you like mood swings. It affects you. Cyclosporin had really bad side effects. You know, you looked after transplant. I looked different. I looked, you know, like I remember being other people mentioning to me later, like, you know, like we had to be ready to visit you because you looked so different. And it's not like I had a mirror. I wasn't looking at myself. I didn't let anybody take pictures of me when I was, you know, younger. I lost tons of weight. I was super skinny. I have a handful of those pictures, and I'm thankful that I have them. But I wouldn't really let people, like, you know, take pictures, and like I didn't want to remember a lot of that stuff. And I wish I would have done more to have more memories about it. But, you know, and it's not really for me, it's for other people who are going to visit me. Like when you see somebody who's sick or even like recuperating from something, you know, you want to be ready for a change. You want to be ready for, you know, the bad side of surgeries at times. You know, I know with cancer, a lot of people who go through chemo and stuff, they lose their hair. Thank God, I'm not. Did it stop?
Somebody called you.
Hang up on. Hello? Okay, so it's back up. I guess somebody called. Yeah. So let's see. That always messes me up. Where was I at? Yeah, just being sensitive, you know. And you know, all the memories, I'm glad I have what I have from back then. Let's see. So how has technology changed from then to now? So there's a huge difference in technology from then to now. I'll speak on so one of the biggest things, and a friend of mine Melanie, who had a I think she had a heart transplant or a lung. I'm not 100%. Back when I did, she had it before me. you have to go under use a ventilator, and that's something that they've been talking about a lot. Being on a ventilator sucks. You know, you have that tube out of your mouth, you're halfway awake, sometimes you're wide awake, and then they like it's nothing you want to go through. And back in the day, they kept you on the ventilators longer because they wanted to make sure that you're strong enough to start breathing on your own and everything, because they didn't want to have to like take it out, put it back in. So that's something that's that has changed. Like, and I learned this with my surgery, my last heart surgery, because I had like 12, 15 years with no surgeries, and just the healing process, everything starts faster now. Everything is, you know, everything happens faster, you know, and it's a better process, way better process, you know. I can only like, after my transplant, I would visit patients waiting for transplant, visit them and their families, and I would talk about my experiences, and then throughout the years I would always go back, not a lot, you know, but I would go back and talk to patients that are waiting, and I was lucky that when I had my last heart surgery, that I was able to relate to them better. I was able to tell them like, man, we're lucky now that it's a faster healing process than before. Like, you don't understand how, like, chest tubes, if you've had surgery years ago, you understand chest tubes hurt so much. They still hurt, but it's nothing like before. It's so much easier. It's so, like, that was something that scared the hell out of me before, and now it's something that it's, you know, it's not as bad. You know, the technology, the doctors, everything that they're doing is so much easier. Like, this machine is so outdated now. Now it's a small little thing about this big. It's connected to your heart, and it's connected to a small machine the size, like half this size of this laptop, and people just wear it like a little bag. And this thing was rough. But these newer machines, everything just keeps getting better and better, you know. So thank God for technology. How does it feel when you wake up? So when you wake up from surgery, every time is a little different. In the past, it was different because they kept you under a lot longer, and you were having, you know, again, I was intubated, which, you know, I had the ventilator on. I had a lot more things connected. Now they know to take stuff off faster because your body wants to heal itself as fast as possible. So that's something that, you know, it's so much. So the last time when I woke up, I was probably on a lot of morphine, a lot of, you know, strong medications that kept me not feeling the pain, and it just wasn't that bad. Let's see. So my last question is, two people asked me, should I possibly do a GoFundMe? In my last video, I talked about bills. You know, bills are something that happens. You know, they're always there. You know, for me, like, just the other day, like 2 weeks ago, I went with my friend to go. She went with me. She drove me to go pick up some medication that I had at Walgreens, and it was only like $37, $32. I don't know how much. And she was like, "Wow, that was a lot." And I was like, "Oh man, that was nothing." Like, those were, I think it was only 3 medications. I take a lot of medications, you know, because of the transplant. And I go to the hospital a lot. I go to my doctors a lot. There's a lot of testing that gets done. So there's always medical bills. I'm really not big on a GoFundMe. I am in the process of thinking about doing something in that sense, but more to really push for my nonprofit that I'm working on. But that's something I'm thinking about. I'm trying to figure out. I really don't feel comfortable like asking people for money. It's not something that I don't know. I just don't. But I'm not opposed to it if that's something that needs to happen, and they're options. Options are out there. But at the moment, I'm okay. But I'm really looking into possibly start doing something, like I'd rather like make some T-shirts and sell them, and make some, raise some money that way, or do something like that, and really kind of like push for my nonprofit that I've been working on. All right. I don't think there's any other questions. Let me look at let me check this out real quick. Thank you everybody who was online. All right. I'm signing off. Thanks everybody.